Thank you very much for inviting me to present today, and I'm just presenting this from my home office. So what I'm going to address very briefly is the impact of the pandemic on our programme in England. And essentially, just as a reminder, we have very high trust in immunisation in general in the UK. We're just coming out of our third lockdown, and we have had school closures during the period of the pandemic. And you can see here the dates of those closures, some in last year, 2020, with a partial return in June and a full return in September. And this year from January to March in the dates that you can see there. In general, we have a supportive media, and the messaging has been that it's been very important to maintain all aspects of our routine immunisation programme. And obviously there has been not just the impact of the pandemic, but of other vaccine programmes, which I'll come to later. So what does our programme routinely look like? Well, it's delivered, the bulk of the HPV programme is delivered through school immunisation programmes. And just as a reminder, we've been offering it to girls since 2008, to men who have sex with men since 2018, and to boys since 2019, using Gardasil 4, as you see here. We have a large portfolio of supportive resources for all of these programs. And as I've already said, the vaccine is delivered largely to adolescent girls and boys through schools, to men who have sex with men through HIV and GUM clinics. And there is an element of catch-up in primary care. So in October 2020, JCVI issued this advice that the priority for the delivery of routine immunisation programme is for all eligible children to receive at least the first dose of the HPV vaccine. And this included prioritising the catch-up of those who failed to get the first dose due to school closures. And this was to allow the school teams to at least focus on this first dose and give them some time to catch up, which you can see addressed in the second paragraph on this slide, which showed that the committee considered that the interval between first and second dose could be extended by a number of years without compromising protection or the boosting effect of the second dose. So that allowed some flexibility to the teams delivering the programme. So what has the impact of the pandemic been? And what I'm showing you here is data from last year. So this will have changed when we come to report for this year. So in 1920, you can see that 64.7% of the year 9 females completed the 2-dose HPV. And in 1920, the priming dose was 59.2% in year 8 females, compared with 88% in 2018-19, and 54.4% for year 8 males. So you can see there the impact that the pandemic, or if you like, the closures due to pandemic, have had on our adolescent recipients. This, if you like, the good news is that this does align with other adolescent vaccinations, and the boys' data is not wildly different than that for the girls. So we can take some comfort in that, in knowing that we've got similar rates in boys and girls, which is good, one of our concerns, but also that there doesn't appear to be any impact in terms of confidence. It's really all about the school's programme. Now, as I've already mentioned, this is likely to be an underestimate, as it hasn't captured all the recovery activity that has been going on, and we'll see that captured hopefully in this year's data. So what about this recovery activity? So there's been a lot of action, and this is the additional data that we'll be able to show next year, there's been a lot of actions on the part of local teams to continue with the offer during the pandemic. And in fact, why am I showing you the Merry Christmas? These are all tweets from local teams, apart from one. These are all tweets from local teams about the work that they've been doing to catch up the programme. Why have I put the Merry Christmas tweet in? That seems a little odd, but what you can see there, and it's probably rather too small to read, but here's a local team, the Lincolnshire immunisation team, and it's refers to what I showed you on an earlier slide. What about the impact of other vaccine programs? And this just gives you an idea of the work that's been going on, where they show that 45,000 young people were vaccinated against flu in just 10 weeks at the end of last year. So it's not just the impact of the pandemic, but also of our other vaccine programs, which have been a great deal of work. Now, all of the other tweets are just coming from their catch-up programs from the Suffolk immunisation team, Cambridge and Peterborough, Southwest Hants, Lincolnshire, and Suffolk again. What you see here is that during the period of the pandemic, the teams that usually deliver through schools have been working in other settings to try and maintain the uptake of the programme. And I don't have the data that I can show you that will show you the impact of that, but they've all been working incredibly hard to maintain the programme. And even in the left-hand corner, you can see from the Suffolk immunisation teams, yesterday, they're saying they're back in schools this week, catching up with students due their ACY, DTP and HPV vaccinations. We've also seen supportive media, and this is how will schools catch up on routine vaccinations. Schools have done their best to deliver their normal non-COVID vaccines of the pandemic, but they still need to catch up. So there is all of this catch up, and that was taken from the Times Literary Supplement. So there's all of this activity ongoing to ensure that we do catch up. Just gives you an idea of the other activities, just some of the, if you like, the communications we've been doing. There's lots more, but not time to show you all of this within this programme. But these are our vaccine update newsletters that we deliver every month. You can see this one on the left-hand side of the screen, taken from July 2020, which was talking about maintaining vaccine update during the pandemic. And we were looking about, on this first one, you can see we're highlighting here the work of the Derbyshire Community Health Services to continue to catch up with the programme. And then in November 2020, we had a vaccine update focusing on HPV. So once we are able to publish our data for this coming year, we'll be able to see how effective that catch-up has been. Which brings me to the end of my presentation. So thank you for listening. We do have a lot of resources to support this programme, and I can provide links for those should colleagues wish to see them. Thank you very much.